All righty. So good morning, everyone. Thank you for joining the part two of the Instructional Program and Course Approval Committee, Allied Health Professional Learning Committee community meeting today. This is a part two of our discussion that happened on, I believe, May 8th. And we had such a wealth of conversation that happened, we needed a part two. So that's a great thing. Hopefully we can keep it going so we can really continue to support our allied health programs. We did a short welcome by the wonderful Dr. Perkins earlier. I just want to acknowledge the open chairs that we have. I want to kick it to Dr. Perkins so that she can introduce the few that are on. I know that Michelle Clark is on, as well as Miss Guerrera. I'm so sorry if I'm butchering that. So if the other open chairs have come on, my apologies. I haven't seen you yet, but go ahead, Dr.
All right, thank you so much, Miss Luke, and I just want to say, you know, I know we all have people in our office who, no matter what, I mean, they are enthusiastic, they are professional, they're about moving it forward, and that is Miss Luke. So I really appreciate her leadership, and so that we can move forward. We know that there's a lot going on, both I imagine professionally and personally in our lives.
Actually go down this way.
And toward that end, I'm sorry. Okay, there we go. And toward that end, I also want to say that just acknowledge, you know, all of the senior staff members here from across our EOC system. Really appreciate you being here. I know we have at least one director, Mr. Ronnie Hector from the Bronx EOC, and so appreciate him for referring our office to Miss Lady Guevara. She is one of our open chairs today. She joined us last time, and you know, just great to talk to a student leader who's now a graduate leader and an allied health professional. And it's wonderful to have her here, and just want to encourage her to continue to participate and join the conversation. We also have an open chair. This is Ms. Clark's, I believe, first time joining this meeting, although she is not a stranger to our system. She is also a senior manager for her organization, the New York State Division of Criminal Justice Services. She runs a very tight ship, and she is very passionate about serving the community and working to see what types of inroads that SUNY and her organization can do on behalf of her Deputy Commissioner, Robert Macarone, around making sure that as people are re-entering the community from being incarcerated, that they have all of the wraparound supports that they need. And we're very thankful to be able to partner with her across the EOCs and the Attain Labs, partnering with her and her team. So welcome, Ms. Clark. So you're very welcome. It's great to have you. And it's great to have everybody. We have maybe about 30 or 40 minutes or so to jump into a conversation around allied health. And as I was reflecting before we started the recording, there's a lot that's been going on in the community. We've been dealing with, you know, COVID-19, the pandemic, and how that's impacted operations and everyone's lives, both professionally and personally. And that, you know, that doesn't mean that our students are in a bubble either, you know. And so toward that end, with what's been happening with the unrest across the country, it's hit home here in the capital region in particular as well. I was remarking earlier that we saw just a really great display of humility and you know, just power in check and responsiveness and engagement with the Schenectady Police Department as they took a knee and dialogue with people who were peacefully protesting so that they could be heard. So as we're working to develop, you know, Ms. Luke and I and others in the SUNY UCAWD office, we have the honor and privilege of helping to move forward policy and procedures around allied health program development, and we do this with our students in mind. I'll just refer to the agenda for today. You know, as our students come in and they're thinking through, how they can be resourceful, in the midst of crisis. What does that look like in terms of how we create a learning community, a classroom community where students feel that, that they can continue to, be heard around their concerns and moving forward in their professions. And we know we already do that well, and that's why we're here to talk about moving to that next level and how we roll that out. So from the discussion last time, we have here as part of the agenda some of the highlights that we wanted to continue to have a discussion around. And so to Ms. Luke's point earlier, just want to encourage people to continue to use the chat feature. If you'd like to talk, I encourage that as well during this short time that we have. So we're talking today about resources, partnering with other organizations so that we can move the dial on making sure that our students have what they need around pursuing their allied health fields, and of course making sure that our faculty and staff have what they need, because if they don't have what they need, then the students aren't going to have what they need. Completion of clinical requirements, externships, HIPAA compliance. We added remote access. There's some guidance that recently came from the provost's office. And to that point, the head of our office, Ms. Lisa McKay, has been extends her greetings and shared some of that guidance. We may have a chance to go through some of the highlights of that, and we're still kind of making sense of what that means based on what legal counsel has shared with us around remote access and some of the guidance around First Amendment rights for students and making sure that everyone is safe and social distancing. And then lastly, there's a lot here, online resources for curriculum, but it's good that we have all of this laid out, and we can definitely leverage the chat, and we can leverage having, future conversations around these pieces. So I just want to start off with, and I hope Dr. Thomas doesn't mind me putting her on the spot a little bit, because I do recall from the last time there being an ask around resources and affiliation agreements. If we could maybe start there and then just continue, and I'm just going to ask people to use the chat feature and continue to dialogue and really encourage our open chairs to feel free to jump in as they feel comfortable.
And Susan, if you can, I'm hearing some feedback here. If you can try to monitor the chat for me, because again, I'm screen sharing, so I can't see all of that at this point. But I'm sorry, I just wanted to mention that. Go ahead, Dr. T.
Oh, do you want me to just talk about the advisory board? And
were you kicking it to her about the affiliation agreement, Susan? I'm so sorry.
Sure, both. Yeah, the advisory board. I remember the affiliation agreements in particular, but if you'd like to talk about the advisory board too, that would be great.
Okay, I'll start with the advisory board. In previous incarnations in my life, working with allied health programs, typically it helps to have an advisory board that would consist of students who are graduates, a person in the field who's in the medical industry, either a doctor or a nurse practitioner, and then someone in the career field, people who have taken our students or have worked with our school students before and can give us some input on what's actually happening in the field. Just keep it abreast of how relevant our curriculum is to the allied health field. So we can do that on a local level. I know that's something I started at the ELC, and it's something typically you have to kind of keep reviving, but it's great if they could meet twice a year to talk about your curriculum, or the idea would be if you can meet 4 times a year. I'm wondering if collectively, as EOCs who are offering allied health, if we could have a collective advisory board that we can all utilize, where we meet at least once a year to talk to that collective board, to get feedback, to see what is happening in the industry, and primarily if we could find a doctor or a a nurse practitioner who can support us when we're trying to get supplies. For example, if we need to get needles, sometimes you have to have a doctor to sign off on that type of thing. Somebody who could say, yes, this person, I am associating my license, I guess, with the SUNY EOCs so that they're able to get those types of supplies. And that just helps to enhance what we're able to do in the classroom with medical assisting particularly.
So we're getting some feedback regarding that idea about having a collective advisory board across the system. That would be great from Rochester. Love the idea of a collective board from Syracuse. And I think that's a great idea too. Any other feedback regarding the collective advisory board? Nope. Okay. So we will follow up on that. And if anyone has any recommendations regarding who would be, part of that board, we're kind of like planting the seeds of that with, with having, open chairs. We've had some open chairs from the medical field. If there are, in particular, people from the medical field that have worked directly with our students that you would like UCAWD's help with bringing together and helping us collaborate and move that conversation forward, we would welcome that. Please, continue to contact Ms. Luke and myself regarding that.
And I would mention that I work with accredited schools, and I've been on accreditation committees that are associated with ABHES. I don't know if people are familiar with Allied. That's a association that accredits health programs as well as ACICS. So when they visit schools, they look to see, do you have that advisory board piece, and if we have those people with credentials that are advising our group. And my step would like to be next, if we could get our program programmatically approved, not necessarily by an accrediting body, but there are other bodies that might be willing to accredit our programs. It just gives a little bit more support and a little bit more breath behind what we're doing, or depth behind what we're teaching to the students. So that's my long-term goal. So I'm just sharing that. And so I'm glad people are interested. And we're working with New York, but I know if we have somebody who's out of state, that can work too. It's just having someone who is a nurse practitioner or a doctor. If it's a doctor, yes, we would want that to be within the state of New York.
No, love that idea. I'm seeing in the chat, scrolling up, love the idea from Long Island, love the idea to share information and concerns. From the Bronx, a note about protocols or policies that may be different upstate versus downstate. And Dr. Elfie, I know that you addressed that. If so, perhaps 2 different boards. Either way, I think this is a great idea. Westchester, a couple of our faculty or nurse practitioners, and they sign off on the request for needles as a note. And then from Syracuse, just asking, for the name of the accrediting organization, and we have that there, A, B as in boy, HES as in Sam.org. Okay, so we have that captured and memorialized for this video as well. That will be on Basecamp so that others who weren't able to join us, this was meant to be an ad hoc meeting, and eventually looking for an opportunity to hand off sharing this to someone from the field who would feel comfortable and they have the time and expertise to do that. I am not an allied health expert, nor do I claim to be. So it's really great to have colleagues across the system who have focused their study and their practice around allied health. And so as a collective, we are stronger. So thank you very much, Dr. Thomas, for that.
Do you want to hop into discussing affiliation agreements for Allied Health? I know that was a topic that was discussed in our last meeting that we had last month. Anyone who would like to kick off that conversation, I would welcome that. And on the back end of that, I do want to share a portion of a guidance that came from SUNY that Dr. Perkins referenced earlier that had some suggested language that might be good for updating your affiliation agreements.
Okay. So the affiliation agreement, I brought it up at the last meeting, and basically we needed something that would that we could present to the clinic or the doctor or hospital to show that these were the guidelines where we were going to follow, what was going to be the agreement between the ELC and that particular health organization. The key thing there is that having insurance for the students. If there was some affiliation agreement that would cover the liability of having a student at that location. Otherwise, if it didn't have that, then we would have to have the student do what we're doing here, is having them get their own malpractice insurance. From looking at the internship guidelines that was sent from Ms. McKay, I guess there is some affiliation agreement that exists, and I just was wondering if we could get a copy of the actual agreement I don't know if she sent the actual agreement. I saw the guidelines, but I didn't see it, what looked like would be an actual agreement where it says the EOC is the, whatever our title would be in the agreement, in agreement with that health organization, will do the following, blah, blah, blah. Does that make sense?
Yeah, absolutely. And just for the individuals who are not clear, actually, I go up to the top. There was a guidance that was sent from Sandra Casey, who's the general counsel in charge at SUNY, to the provost, Dr. Todd Lawson. And they mentioned a couple of items in regards to externships. And I do want to circle back to that when we discuss the externship topic in this discussion. But just to your point, Dr. T, sorry for scrolling, there is a section on the document. The guidance is only 3 pages, and I will send that out in the notes to the follow-up of this conversation. But I highlighted this specific thing because you were talking about the insurance language to make sure that our students are covered. Of course, the EOC wants to be covered, but this is the language that they have here. So I don't know, let's say CityMD, that's something in the city. So CityMD is the partner, represents and warrants that it is currently and for the term of this agreement will continue to be in compliance with all applicable laws and regulations regarding social distancing, PPE, and other applicable safety protocols associated with COVID-19 crisis. Failure to comply with this provision will be considered a material breach of this agreement. So I'm wondering if any of the centers have kind of gotten ahead of these things and have some of this type of language to make sure that not only the EOC is covered, but as well the students are covered. I think there was some information in the chat. I can't see, but I know things pop up. I don't know if anyone's discussing.
I just see thank you, Dominique, in the chat, and I know just to Ms. Luke's point, that this is very, very new. I don't think we've even had a chance to discuss this with the directors.
As of May 26th, very new.
Yeah, so it's something that that Ms. McKay highlighted this morning as background information, so that if it were to come up, you know, we're not sure how much the directors and their teams have had an opportunity to, discuss this and plan around it. We imagine that those, and actually just a clarifying question, I'm keeping an eye on the time too, because I know there's much to discuss. Any guidance from the CUNY chancellor, and my apologies, I'm sure, like if there is, I have not had a chance to research this on CUNY's website, so maybe like right there, but if folks from the schools in the city wouldn't mind adding that in the chat or sharing if they've seen similar guidance from staff at CUNY system. While that question is out there, I just want to read in the chat, and this is from Dr. Thomas to everyone. Does this actually cover EOC students? Can we have the original agreement document? CUNY no longer lets us, yes. And we realize that there's that parsing of language where we have the students are SUNY students. And so given that SUNY UConn has an opportunity to make sure that we're helping with those agreements that particularly concern the students. Back to the CUNY piece regarding faculty and staff and working within this remote access environment. Is there anything that people have had, or even regarding CUNY students, that we might consider as we are discussing crafting procedures for the SUNY students? Is there anything that anyone can drop in the chat from CUNY system regarding that? If not now, later, we would welcome an opportunity to see that. And that's everything in the chat for right now.
Oh, okay. Okay, great. So let me go back to the other presentation. One moment. And okay, so we were able to discuss, of course, the the affiliation agreements and the advisory board. I want to draw attention to Tricia Chrisman from the Rochester EOC, who really was interested in the online resources for instruction that we're sharing throughout the system. And it's wonderful because we have many centers represented here today, as I mentioned at the top of this meeting. So if there are any online resources, particularly for the allied health programs, that you feel are great and that you'd really like to share with the rest of the system, please discuss that at this time. Tricia, I'm not sure if you want to kick it off or if you're just really looking for some other resources from the system.
Sure. So my background is not allied health, it's math. So, and I just started in this role in July, so I'm still learning all of the different curriculums for all the different programs. So I guess being the person who has to support my faculty with online learning and Blackboard, just trying to find out if there are any great curriculums out there to help support everything from LPN, CNAs, MedSecs, home health aides, whatever's out there that we could use that people have found to be helpful and align with the state guidelines.
Any resources from the group? I don't know if there's anything happening in the chat.
Nothing in the chat, but I know we're sharers.
We are sharers, so don't let us start picking on folk.
I think with allied health programs, depending upon what you're going to be running, you have to kind of look at what the state is requiring. For medical assistant, that pretty much is the same as far as what they can do going from state to state. So typically, we're trying to train them on the curriculum that relates to NHA. And I'm finding that Cengage is offering quite a few things that I can get if we could do a book subscription. I'm still working out that. It seems there's still a little bit of trickiness with working with that, but that opens up a lot of online resources that they may have. With CNA and LPNs, I've worked with those before, but I'm not familiar with what New York requires because I'm originally from a different state, so someone else may have something about that.
All right, just reading from the chat. Associations help, such as NBC associations. Thank you, Ms. Allen from Syracuse. Ms. Augustine from Westchester says, does anyone have any resources for LTC experience for CNAs? I'm not clear about that question. Are we talking about attain LTCs or something else? Could you, if you could clarify, Ms. Augustine. Okay, clinical. Okay, thank you. So, and we have a question, what does MBC stand for? I had the same question, so I appreciate that.
Medical billing and coding.
Okay, thank you.
Yeah.
All right. And now everyone's like, oh, of course, medical billing and coding. Okay, got it. Okay. Then let's see.
So I'm sorry, did we, Ms. Augustine, did you want to clarify your question more, or can we answer? Is anyone else on the group, can we answer?
Yes, I was trying to say, right now, I have 2 groups of CNA students waiting for their LTC rotation to be completed so that they can be eligible for taking the state exam. So the nursing homes we have affiliations with, like they're not letting anybody in until further notice. So anybody has any ideas, and I haven't heard from state, even though I wrote to them a couple of times. Is there any waiver or anything? I haven't heard from them. So I'm trying to see, anybody in the group has any information about it.
Anyone?
All right.
Just trying to give a wait for anyone who wants to help out Ms. Augustine with that. I know we want to jump into also to a conversation about the completion of clinical requirements and that lends to it. So you have to have a certain amount of hours to then be eligible for a test and these things. So us as a allied health, PLC, it would be great if we can kind of get our minds together to see how we can help each other and help our students, of course.
So there's there are a couple of more updates here in the chat from Mr. Goggins. Did they mention NHA certificates or certifications? And then from Ms. Allen, AAPC, AMBA. So let's go back to the NHA certifications. Would anyone like to comment on that? Mr. Goggins, would you like to comment? I think you're on mute.
Can you hear me now?
Yeah, we can hear you.
Oh, okay. Sorry about that.
No worries.
Yeah, I just wanted to know if that came up because I know that that's such a big part of it. We have a number of our students now who are actually in the process of getting their certifications. They're about to, and BCC also, at BCC also, and BEOC. So I just wanted to, I didn't catch that part if it was even mentioned, if it was mentioned, if someone brought it up. Because now apparently CityMD, and talking to them recently, they're really, because of everything that's going on, it's becoming almost mandatory now that you have to have a certification in order to even do an internship. It's going down that road where they're making it, like mandatory that you have certifications.
Thank you for that.
No
Anyone
problem.
want to comment? Anyone want to comment? Anyone have anything to add?
For NHA, you know they're doing remote certifications, right?
Yeah, they just started.
Right. So our students are preparing for the remote certification, and we're suggesting that they go to the PSI site to take it because so many students have technical difficulties. I rather them go to the site, and the site is following CDC guidelines. So we're still not clear how soon they will take the test because they have a limited spacing due to following the CDC guidelines. But we've working with the rep I have, we sent out kind of the instructions on what will happen for them to do the test, and then we also do reviews at our site. So we're preparing them at our site, but they have the instructions on what to expect once they register for this test and go to the PSI site. I hope that helps.
I have a question to Dr. Thomas. So these students, like, are they doing their STRICS and EKGs?
For the clinicals, we're going to have the students come back. So we're going to pass them on theory, and then we're going to have the students come back and give them the clinical piece and then get them prepared for taking their EKG or phlebotomy. So we're going to do the same for phlebotomy and EKG. We also offer CPR classes to the medical assistants. So we thought we could do that remotely, and then we found out that they have to do the practicum on ground. They're only letting people who are renewing their CPR to do it remotely. So we're going to do all of that training once we're able to get back on ground. So everything is kind of up in the air to when the governor says we can start bringing in people, even if it's at a limited basis, and we're preparing to do it that way.
Thank you.
And just a note, as I keep an eye on the chat, as if there is a programmatic change that you're planning, and you're thinking through how to move that forward, if you would currently, per the SUNY UCAWD guidelines, if you hear about a change and it's substantive, it will change how you're going to roll out your particular allied health course or program. All that you need to do in order to just make sure that SUNY UCAWD is looped in is to just write simply, it can be a few sentences. You send it to your liaison, feel free to copy me, and add a copy of your IPP, your instructional program plan, and that's typically in each center's operational plan. And what you would do is just send a copy of that, include what you're planning to change, and you can simply write, that it was something that was discussed as part of the, professional allied health professional learning community, and this, this is a new requirement, or this is something that we feel will increase enrollment or increase our outreach efforts. It does not have to be a thesis, and actually we prefer it not to be. As simple as possible, a few sentences in terms of any type of substantive modifications. Does anyone have any questions or comments regarding that before we move on to the next question?
So if it's a temporary, like this is, for example, we're going to do the clinical piece once we get on ground. This is not going to be a continued practice. It's only because of COVID. So once we're back on ground, we're going to run our classes the way we typically would run it. So you would want that notice that temporarily we are doing for this semester this type of training.
Excellent question, Dr. Thomas. Actually, if it's just a COVID, I don't mean just, but if it speaks to this temporary pandemic situation, the centers simply need to update their business continuity plan or contingency plan, and note that. Just keep your liaisons updated in terms of what those changes are. If you have not already had your AORM, it may be something that you may want to highlight as part of the notes for the AORM, but we want to keep it as simple as possible. So thank you for raising that. I'm looking at the chat. Okay. All right. Now I want to give an opportunity for open chairs, and I'm going to just state here publicly that I'm keeping my word. This is a very family friendly conversation here. When Miss Guevara and I and actually others who are either on this call or others, when we talked about, you know what, I'm homeschooling while I'm trying to do other things as well. So I will be there, but you know, I might need to attend to this or attend to that. So I definitely understand that, but just wanted to just give Miss Guevara and Ms. Clark an opportunity to, you know, also chime in. First, Ms. Guevara, as we've been talking about helping to support faculty and staff to support students in what they need to move forward in their careers, any thoughts about as students are being asked to engage in a remote environment, they're you know, expected to now, you know, complete certain requirements remotely or online. Any advice or any thoughts that you wanted to share to faculty and staff as they're rolling that out?
Good morning, everyone.
Good morning.
I think remote learning is a good idea because it helps you continue instead of just being completely on pause with everything, waiting for everything to go back to the regular session. But I know that not everyone works, not everyone learns. Some people are like more like a hands-on person. So I think it's like 50-50 for me, because like me, for example, like I like remote learning. In the past I've taken online classes, but at the same time I also like hands-on, being able to ask questions and being able to discuss things. So I think it's good. It has pros and cons, just like anything else. Because especially with like my field, medical assistant, there is a lot of hands-on, but like the beginning of the program, it's not a lot of hands-on. It's pretty much learning the principles and like everything you're supposed to do. It's more like actually like reading and doing tests and things like that. So I think for that part, it's good to continue remotely so you could keep on advancing and not just be completely on pause. But then you also need the hands-on learning as well.
I love that. Great points. You know, just the importance of keeping in mind that balance, that, you know, we don't want everything to stay on pause. We want to move things forward as much as possible, but keeping in mind that for a number of students, this is very foreign, this is very new. One of the reasons why they chose the EOC is because they could come and have that face-to-face interaction and get that support. And so being able to, you know, keep that in mind as we roll out policies and procedures and implement changes to curriculum is really key.
But I think one thing that they did teach us there that was important was like to have like our little groups in our study groups, because like for instance, let's say for instance I will be doing right now remote learning. Like we did it like this while we were in class. Like we will get on FaceTime, or we'll use like different Google Duo we'll get online and we'll all study together. That's how we would do it. So I think that will be good for like people who are not so much for just learning on their own by looking on the computer, but like we would like go on FaceTime and we would like study together. Like, so that's why I think it's very important, like to have like when they would tell us like, you know, make your friends, you know, study together, people that you know you'll focus in your study with, because a lot of the times when we had quizzes, we had exams, like it will be a few of us people that were in my group, we will be on like studying together, like reading the book, going through our notes, like giving each other, like we will be quizzing each other on over FaceTime. So I think that's like very important as well, like to have, like they encouraged us, which was really, I'm glad they did, you know, to help each other out, because some of us are not the best at remote learning. But when you have like, you know, you have a friend that you're on the phone with and you're quizzing each other and you're like studying together, that helps a lot.
Thank you for raising that. And I mean, and those are just, you know, pretty, you know, straightforward. I mean, even if you necessarily aren't thinking about holding a Zoom call with someone, but being able to have a phone call and check in with them is really key.
Yes, definitely.
Thank you for that, Ms.
Some
Guevara.
things come up in the in the chat there. And of course, I'm keeping things on time. And I know you, Dr. Perkins, you probably want a chance for Michelle Clark to John. And what was the thing mentioned in the chat?
So thank you, Ms. Luke. I just added what are ways that centers support student study groups, and Ms. Chrisman from Rochester added, this is great, working together and building community definitely helps. And so,
For sure. Okay, I just want to, while people continue to go in that chat, and again, we will save that chat at the end of this call and send it out in the meeting documents after this meeting. I did want to, just share again the guidance. And again, the centers are equipped to continue to, to do what they've been doing. I know there's been a lot of contingency plans, to make sure that we support our programs. I just wanted to highlight a couple of the items in the guidance again, which I'll be sending, to the group because it's very fresh, it's very new, and I'm sure the centers really need to, think about these things and how it may help their students. So they talked about, these are the 3 questions, what's going to happen about internships. And as we have this discussion around allied health programming, we really need to think about, okay, what's going to happen with clinicals, right? So I wanted to, sorry for the scrolling, I just highlighted a couple of options, that there's no blanket SUNY system-wide prohibition on the in-person internships. So, centers, will continue to use their discretion when it comes to that. But, one of the highlighted items in the guidance was that, students don't have to feel pressured to participate on the on-site internships. I'm sure, of course, you want to encourage them to complete their programming, as clinical is a requirement of completion, but we need to think about, the student as a whole. I know that Ms. Guevara, on our last meeting, she mentioned about the the emotional intelligence aspect that the students in the allied health field have to overcome, and they really have to really band around what they have going on with themselves, so they're able to really help their patients. So that's one thing that we kind of wrapped in that I saw from this guidance. Also, they're really looking to do remote-based learning. Of course, I don't think they were really thinking about the clinicals for that, but again, this is guidance about programs overall, right? Internship sites should consist only of those that have completed internships. So you really want to think about the existing relationships that you have with partners, which I'm sure your centers are already thinking about. Making sure that, and I know that Mr. Hector of the Bronx EOC already talked about on the last call about making sure that we're looking at federal guidances and protocols from Department of Health. So of course that's noted here in this guidance. Also coming up with a plan B, just in case the student, doesn't feel, comfortable with participating. They just want to know what all their options are. So if you're able to come up with that type of thing, please do. Acknowledging that the students have been presented with the alternatives to, as I said earlier, to the internship. We already talked about the affiliation agreements, and then there's, a portion of that about the First Amendment, really relating to what Dr. Perkins was saying at the top of the call. Understanding people's personal rights, and things like that. And if a student what if a student chooses not to wear their mask, and how that all wraps into their internship clinicals, and having to understand the protocols that the partnering site has, and then, EOC liabilities and things like that. So there's a lot to unpack with this guidance. And I'm just curious, just first draft, I'm not sure if the members on this call were able to look at this, but just really curious on your thoughts about the internships and how we should be moving forward, of course, in a safe way for our students. Anyone want to share thoughts on the externship? Anything in the chat, Dr. Perkins? Not as yet.
Yes. I think this is a really good time, and I think that as people are still kind of making sense of the new guidance and kind of thinking that through. I'm gonna read. Oh, we have some really great feedback in the chat.
A lot of feedback.
Yes, and I'm going to invite Ms. Clark before we close up and wrap up, just to comment as well. But here we have let's see. Oh wow, lots of activity here. Okay, let me scroll down here. The Westchester EOC is using Google Suite, Google Classroom, Google Meet, and Zoom. Google Suite allows sharing work to the question that and the point Ms. Guevara raised around students working together and supporting one another. And just starting that professional collegial community, or continuing that is really helpful as they continue to move forward in their careers, right? Okay, let me keep going here. All right. Ms. Chrisman, Rochester EOC, we have office hours online and the students interact with each other there. Sometimes they elect to share their contact information and connect outside of the office hours, or, just being respectful that some students may not want to share their contact information, and we have to, be mindful of that, and we definitely have an obligation to protect students' personal information. We use Blackboard, Collaborate, and the Remind app. Thank you for that, Ms. Corcoran from the Bronx EOC. What Ms. Guevara describes as a pretty organic activity we have seen develop, especially in our allied health programs before COVID-19. Now that a lot of instruction has moved to remote learning, instructors have begun to more actively participate and offer assistance and availability for answering questions. And we know in the Bronx EOC, as we've seen across other centers, that there's this environment that is created around collegiality, right? And we have that across the system. And so, our students see what we do, and they're encouraged to do in kind. Although I'm sure Ms. Guevara came with a lot of leadership skills along that vein before even coming to the EOC, which is evident from her participation today. All right, Ms. Clark, I would like to add that at the Division for Criminal Justice Services, we are currently funding 20 county reentry task forces and 13 employment-focused services programs across New York State. And we have a representative. If Mr. Goldwire was here, he would give kudos and commend those who are part of the reentry task forces, that the EOC representatives who have been actively participating even through the COVID-19 pandemic. So DCJS is currently funding 20 county reentry task forces and 13 employment-focused services programs across New York State. We are currently partnering with SUNY UCAWD to educate, inform our grantees, as well as the county probation departments, on the resources available at EOCs and Attain Labs across the state. Building resumes, providing justice-involved youth and adults with opportunities to advance their education and prepare themselves for the world of work are some of our goals. The new normal requires us to revise our way of providing resources. Remote learning is becoming more and more important. Thank you for having me here today. Ms. Clark, did you want to add to your comments?
Good morning, everyone. I got us 4 minutes before noon, so I can still say good morning. Thank you for having me. I enjoyed this conversation. I feel like a lot of what I can take away from this is how we're all trying very hard to acclimate ourselves to the new normal. And while doing things online has its challenges, doing things remotely has its challenges, what we're learning too is that we have more participation across the state. Well, a lot of our initiatives, I was reading one of the other pieces on the chat here, instructors have begun to be more actively participating and offering assistance. I find that too, with what we're doing in our work across DCJS and specifically in the Office of Probation and Correctional Alternatives, where we once didn't have a whole lot of participation in some of our meetings and some of our reentry task force meetings where partners are together, are getting together to talk about issues in the county or ways we can address barriers in the county or ways to provide resources, whether it be COVID related or just vocation, education, reentry related conversations. Now we have more people at the table because we have the remote learning, because we have Zoom, because we're using video conferencing. Whereas it used to require that we get in our car and drive 6 hours to be at these meetings. And I couldn't make all of those meetings, obviously, because I couldn't be at 3 places at once. So now I can jump in one call, jump in one meeting, get out of that, go into another. So with this new normal, which can be very challenging and sometimes uncomfortable, I think we are seeing that there are a lot of positives coming in as well. I needed to note that because I'm seeing a lot more connectivity now.
Absolutely, absolutely, and along that vein, we've been working with Ms. Clark and her team. You'll hear more about this from Mr. Goldwire to offer some training around making sure that some of our most vulnerable citizens, those who are entering from the criminal justice system, that we're continuing to build our level of expertise so we can better support them. And so we're working. We'll see. Maybe over the summer you'll be hearing about that. Yeah, we're working really hard, so we'll see. Thank you very much, Ms. Clark.
Thank you.
Awesome. So I see that in the chat, since I'm not sharing anymore, Dr. Perkins, I could see. I see that Brooklyn shared that the faculty also have office hours to support the students. And they also, of course, Brooklyn coined the Schoology, and I see that the Bronx is also using Schoology, so as well as Google Classroom and Zoom. And Bronx has also seen their students use WhatsApp. So that's awesome. We're using as many technology features as possible to make sure that the EOC faculty and staff can connect with students, and then students can connect with each other. So I think that is great. Looking at the hour, we have 1 more minute. I think we've had a robust conversation today. We've recorded this call. We've saved the chat. I will send the PowerPoint as well as the guidance for today and a couple of notes. And I just want to appreciate everyone for taking the time to be on this call. And of course, our wonderful open chairs. I appreciate you being able to join us today to add to the conversation. If you have any questions, please feel free to contact myself or Dr. Perkins to see if we want to continue this. As Dr. Perkins mentioned earlier, if there's anyone who is interested in chairing this ad hoc committee of the IDCA for Allied Health, that would be great. Please reach out to us. We'd love to continue that conversation. So if there are any other thoughts, we may conclude the call. Anyone have any other thoughts? Okay. All right. Well, thank you, everyone. Again, I appreciate all of your feedback. You will receive an email from me probably tomorrow with all the materials. I will be adding it to the Distance Learning Basecamp. And, oh, Dr. Elfie. Oh, maybe we're not done. We have some things coming in the chat. We're looking at different types of learning. Okay, you know what, Dr. Elfie, we may have some information to share on a next call. I like a lot of this conversation. We're continuing with student supports. There is a student support base camp or something that I created the last time when we were talking about mental health. We may want to continue this conversation. Thank you, everyone. All right, I will conclude the call, and more information to follow about continued conversation. All right. Goodbye, everyone. Thank you so much.
Bye, everybody.
Bye.
Thank you. Great job, Ms. Luke.
Thanks, Dr. Perkins.